Thank you, Logan. Well, we're taking a deep look into the artificial intelligence revolution in the health and medicine field. And here to discuss is Dr. Camille Nebeker and Dr. Chris Longhurst. And they're both from UC San Diego Health. Welcome. Thank you so much for being here. Well, AI is taking over, and let's start with you, Dr. Nebeker. So right now, AI is being implemented in critical care units, in the operating rooms, and even at home, but that also comes with implications when it comes to ethical and social. Can you explain that?
Well, we really have to think carefully about the safety, the efficacy, and all of the pieces that go into the models that are being used for predictive analytics. Chris can tell you a whole lot more about how they're implementing this in the health system, but a lot of my work involves working with people who may be patients, and learning from them about what they're fearful about, how we might explain AI to them so that they understand how it works. We also want to really make sure that the data that are used to train the models are representative of the people that we're hoping to help. And so it's really critical that our data sets are very diverse so that we can really help the public and improve health.
And Dr. Longhurst, what is your take of AI in the healthcare industry?
So first of all, I absolutely agree with Dr. Nebeker. We have to implement this in a way that's safe, respectful, and trustworthy. That being said, I am also really bullish on the opportunities. I think we have the opportunity of a lifetime to improve the quality of care that we deliver to all patients. Just recently, UC San Diego Health demonstrated in a peer-reviewed publication a 20% drop in mortality of sepsis in our emergency departments that occurred because of an AI algorithm that's tirelessly helping to observe every patient 24/7 for signs of sepsis. And that helped our clinicians to identify it earlier and give that life-saving treatment. So we think there's all sorts of opportunities to implement this type of thing in a safe, respectful, and trustworthy manner.
Yeah, and this is all new too. And many of our viewers are thinking, well, can I really trust AI? Right now, there's a Senate Bill 1120 that has been proposed, and it is basically requiring physicians to make the final decisions for treatments rather than AI. So, as working in the medical field, do you trust AI, and should patients really trust AI?
I think that's a great question, and first of all, I would say we're big supporters of that bill. We don't think that AI should take a human out of the loop. We always want our doctors and our clinicians involved in decision making. AI can help support that, though, in a way that makes it easier to both deliver and receive care. Secondly, we're big fans of transparency, so we were the first in the country to use generative AI to help respond to patient messages for our busy doctors. But at the end of every message, there's an addendum appended that makes it clear this message was automatically generated but reviewed and edited by your doctor. And so that level of transparency is going to be what helps to engender trust.
Yeah, if one of you can share, when a patient is at the hospital or the clinic, how will they know whether it's an actual physician's eyes or AI reviewing their record?
I think what Dr. Longhurst is saying is that the human in the loop is so critical at this point in time because there are mistakes being made. And if you ask the AI to summarize a doctor-patient visit, it may come up with a hallucination, something in the record that wasn't quite accurate. And so having somebody human being able to verify that until we get more sophisticated systems, I think that's going to be critical. And we're also doing a lot of research to make sure that the systems that are getting put into the pipeline are valid and that they have been trained on a representative population. So all of these steps of research that go into putting something into practice, those are critical steps that are not being overlooked. And as Dr. Longhurst mentioned, we've been doing this for over 5 years. My Research Center for Optimal Digital Ethics and Health, Recode Health, we've been around for almost 7 years now, looking at how do we do social media research ethically? How do we use all of these different tools that were never intended for health research or health care, but are very much part of what we're doing now?
I wish we had more time to discuss, but there is a virtual event happening on Friday. You want to quickly tell us about that?
So on Friday at 12 noon, we're doing the AI Revolution, and it's a deep dive where Dr. Longhurst, I, and Dr. Reek from Computer Science and Engineering, and one of your colleagues.
Dr. Mike Schnitzel as well. We're excited about this. We're going to review a lot of different uses of healthcare AI and how to make sure that it's being used ethically and responsibly, and we're going to be taking questions and answers live. So hope your viewers can tune in.
And how long have you been in the medical field?
Oh boy, I'm not sure I want to reveal that, but it's been more than a couple of decades.
And how about you?
About 25 years.
Did you ever think, just look back over all those years, did you ever think that this would be the healthcare industry now, AI?
I've been in this part of it for 10 years, and so I was in the very beginning of this and could see how exciting and the potential for health to be improved by AI and digital tools. So I've been writing this for a while, and it's exciting, but it's also really important that we do it well and we take it careful.
I've been doing health technology for over 20 years, and we've introduced electronic health records in an effort to improve care, but unfortunately there have been a lot of downsides, doctors typing at computers. And I see AI as a tool that's going to help us to rehumanize the medicine.
It's definitely an interesting topic and so much more to look into, dive into as well. Dr. Nebeker and Dr. Longhurst, thank you so much for being here discussing AI in the healthcare industry.